All right, if you will, welcome a guy that knows a little bit about what's going on with healthcare. He's the CEO, that means he's the top dog, of Memorial Hermann Hospital in the Woodlands. Welcome, Mr. Steve Sanders.
Good evening. Lucky me, I get to speak before Jim McIngvale. And I've heard him speak on a number of occasions, and you're going to really enjoy his speech. As I walked into this room this evening, you could really feel the patriotism that's in this room. And immediately I thought of my son. My son's a graduate of the Air Force Academy. He's a captain in the Air Force. He's a pilot. Thank you. And he's serving his second term in Iraq. So I think about him today a lot, and all the men and women that serve with him, and I'm very proud of everyone that's serving in our military today. Thank you. I want to spend just a moment talking a little bit about some perspectives on healthcare. Today, not too many people are happy with what's going on in healthcare. I can tell you the doctors are not happy. The hospitals are not happy, business is not happy, and you as consumers are not real happy. And a lot of that has to do with the cost of health care, and that's understandable. But there's lots of reasons for it. This cannot be the forum to discuss those things. It's a very complex topic. But the fact of the matter is, we do need reform in health care. Our costs are just too high, and we can't sustain that over time. But there are ways to address this problem that does not involve the nationalized healthcare system. I truly believe that to solve this problem is going to be in the private sector, but it's also going to be with the federal and state government. They're going to have to be partners in solving these issues, because we still have the problems of the uninsured, the poor, the medically indigent in this country. And we have to address that problem. And if you don't believe it's a problem, come to the emergency room on a Friday or Saturday night, and you will see the problems that we have in Montgomery County, in Harris County, and throughout our great country. It is an issue that we cannot bury our heads in the sand. It is truly an issue that we have to deal with. But I don't believe socialized medicine is the approach. In fact, I believe the government is part of the problem right now. And if they we live with the bureaucracy of the Medicare and Medicaid program right now. And I'm sure those of you that may be beneficiaries of those two programs in this audience understand, because you deal with that bureaucracy too. And it's frustrating, it's extremely costly. It's been projected that 30% of all the healthcare costs in this country is attributed to regulation. And I truly believe that, because we live that every single day. I'm going to reiterate some things that were said earlier with regards to healthcare services under some type of nationalized healthcare program. And frankly, for the life of me, why our members in Congress and even the American people are so enthralled with the thought of a socialized medicine, and they've not looked just to the north of us in Canada and in Europe to see what that system is all about. I can tell you that in Canada, if you want an MRI that's not an emergency, it will take you maybe a year to get that procedure done. If you want a CT scan, it'll take you 6 months. If a doctor orders one of those tests today, in all likelihood we can do that test today or tomorrow and have the results to the physician within a matter of 24 hours. That's the kind of healthcare system we have in this country. There is a neurosurgeon in the Woodlands who just so happens to be from Canada. Doesn't that tell you something? He's not in Canada, he's here. And he told me on more than one occasion, as we've had head trauma patients come to our emergency room that have been treated and rushed to the OR to have their lives saved. He has told me, you see that patient there? In Canada, we would just let them die. In England, in the British system, if you reach a certain age and you need renal dialysis, you don't get it. In Europe, if you need a knee replacement or hip replacement, you could be on a waiting list for 2 to 3 years. Now, I know there's people in this audience that have had hip or knee surgery, and you know how painful it is prior to having that surgery being done. Would you like to be told it's going to be 2 or 3 years before that hip or knee surgery is done, and you have to suffer all that time? Of course you don't. So I want to leave you with this one thought. If you don't remember anything I've said this evening, remember this. There is only one way in a nationalized, socialized healthcare system to save cost. Only one that has anything of substantive worth. And that's rationing of healthcare. There is no other way to do it. None. Anything else you do is nickels and dimes compared to the rationing of healthcare. Well, thank you so much for allowing me to speak before you today. And God bless America. Thank you.